Welcome to another episode of Aesthetic Revolution, the podcast. I'm Dr. Ed Zimmerman, your host. Stacy Taylor Zimmerman, my esteemed colleague and the woman who keeps me from crawling down rabbit holes while we talk about everything from forehead to feet with a concentration of what's in between in terms of aesthetic procedures. And today we're going to talk a little bit about something that's in between, that's near and dear to our hearts, the Brazilian butt lift. And we'll reveal our little assistant here. And, it's not just women. There are guys who come in with really flat butts and want to have some butt accentuation, but we certainly get particularly a younger segment of patients who come in who want to have very accentuated butts. And, we wanted to do a little education on this because it's really not just the butt that's involved. It's really from the bra roll all the way down to the lateral hip and everything that's in between and how we address that. Is that fair?
Yeah, absolutely fair.
And, sometimes gals come in alone. Sometimes they come in with their girlfriends or sometimes with their male partners. And so we have to have, very strategic discussions about the butt and what it takes to get enough fat to get projection of the butt, or whether we want to have a more natural looking curve because Mother Nature has supplied them with more tissue at the top of the butt. And, the things that we do to really accentuate the tush, it's not all about fat grafting. And we'll talk, we've had some segments on fat grafting, but we'll talk specifically about this, where we like to hide the insertion sites, some of the pros and cons and risks and benefits, and the realities of fat grafting to the butt, and what your expectations, realistically can be. How long can you keep this fat? Is it generational fat? Are there lumps and bumps in it? Or is it soft, smooth, supple? Those kinds of things.
And also we'll talk about fillers that can also be used in place of fat. Which
some people
we do a lot of.
Yeah, we do a lot of long-lasting fillers. So the same fillers that have been in these two cheeks for the past 8 years, if you use more of them, can be in these cheeks. Now, obviously, fillers are dearly priced. They cost more per ounce than the cost of gold, even these days. And so we use filler more as a biostimulator, and it helps a little bit with cellulite. It doesn't fix stretch marks, but it does give some protuberance to the butt, or it can fill in some lateral hip dips and things like that for people who don't like that athletic hollow on the lateral side of the butt. But it's not the same as a Brazilian butt where you can really build out the tissue with tissue. Mm-hmm. So that's kind of cool. So somebody comes in, they're in basically good health. They don't have reasons not to do liposculpting. Liposculpting, as we've talked before, is all about changing proportions. And when we do high-def lipo, what we take is as important as what we leave. So when we look at a butt and we get somebody into some skimpy underwear or a thong or a disposable paper garment or something like that, and we look at the curvature of the back, the curvature of the spine, the relative height of the two hips, because part of doing a Brazilian butt is cutting in the waist. And the true waist is where the ribs stop and the top part of the hip bone begins. That's the true waist. The belly button is usually within an inch above or below that line, wherever it may be. And the tush actually starts far below that. So we have the vertical gluteal fold. And at the top of the vertical gluteal fold, we want to have a gradual curvature that leads to the top of the butt where the dimples are more medial to that, and then curves down and blends in with the inguinal fold, the lateral butt, and the hip, and then the fold underneath the butt, which not everybody has, particularly if you have enough volume, pushing out. That horizontal fold underneath the gluteus area has to be blended and even. So sometimes we have to put a little volume down there. If you get too hollow or too much volume down there, you get the old lady butt, the sort of saggy, heavy butt underneath, and nobody really wants that. No. And an area that I think is part of the art of doing a Brazilian butt is augmenting the cheeks in between that pushes the cheeks apart, almost like a nice thong does. Otherwise, when the butt cheeks are deflated, they fall together and you don't have a nice looking butt. So artfully putting enough volume that pushes the cheeks apart down deep at the base of the vertical gluteal fold so that you can have augmentation and projection and roundness, but sculpting that waist in. So we first talk about where we're going to be sculpting, and we're going to hide insertion sites under the lateral fold of the breast. So in the inframammary fold, we may hide insertion sites inside the belly button or right adjacent to it, or down underneath where the thong would cover. So we want to make our 3 to 5 millimeter insertion sites so we can shrink that waist in as tight as we can in front, and then in back we'll see where we can hide some insertion sites either from where the top of the butt is going to be, or from the bra roll up here, or along the trapezius, and we'll hide our insertion sites. And then coming across the horizontal gluteal fold is a good place to hide an insertion site, sort of midway in between, both for sculpting the tissue and for fat grafting. And then at the top of the vertical gluteal fold, we can usually hide a small 3 millimeter insertion site that's generally going to be covered by Mother Nature or the thong. And that's a great place to do fat grafting. So unlike some places that will just go to the middle of the butt and start throwing fat in, we're going to hide our insertion sites, and we're going to map everything out so that we can radially crisscross and build projection, or build lateral projection, or fill in a hip dip, or accentuate a hip dip, and lift the butt up, but curve in the waist so that long-waisted look gives you a look of projection before you've even put the first morsel of fat into the tush. So it's an art form. There's a lot of subtlety to it. And of course, the skin envelope needs to be tight enough to really show what we're doing. So if you have a lot of lax skin, a lot of sun damaged skin, or you have stretch marks that we see very often in those areas, there may be a limit to what we can do, or we may have to shrink wrap the tissue first with an energy source. Now, our favorite energy source in our office, having gone through decades now of shrink wrapping skin, we've used lasers under the skin. We've used monopolar radio frequency and bipolar radio frequency. Our favorite thing to do now is plasma energy. Plasma is the fourth state of energy, like the sun. And so the Renuvion device, which we've had really since its inception here in the United States, has allowed us to tighten the tissue, the fibroseptal network under the skin where it connects to the underlying tissue covering the muscle. You can shrink wrap that in 15, 20, sometimes 30%. So you can shrink wrap that tissue, and then you can graft fat into that same space. Now, obviously with fat grafting, we like to stay close to the surface. We use ultrasound to image that area first to make sure there's no big blood vessels, because there have been issues with safety and fat grafting. People who have been fat grafting blindly and thinking they were doing well have gone into the muscle with cannulas and injected fat blindly rather than on retrograde or under ultrasound guidance, have inadvertently caused fat to go into the larger vessels there and cause pulmonary emboli and death. So, that would certainly be a concern. Fortunately, we've never had that issue, but, we've been very careful and we've been very conservative. So we want to be able to sculpt using high-def lipo principles, bring that waist in as tightly as possible, and then give that subtle projection that blends down into the thighs and the lateral hip and gives a nice negative space, around the inguinal fold. It looks good in women as well as in men. And that really helps 360 give you that feeling of butt projection that can be subtle without being overwhelming, that you can keep for years and years. Now, this is a many-step procedure. So somebody comes in for their consultation. We get them into a soft, comfy robe in front of a mirror. We go through all their medical issues. We look at the consistency of the skin, what the structure, the skeletal support, and then we investigate, what are you looking for? And how long can we make it last? Because probably 50 to 70% of the fat that we move, this is a macro fat shifting experience, is going to stay put, but a certain amount of it isn't going to. And we're going to need to put that fat in. It's a living graft, so we want to put it in a way that's going to survive. So we're going to bring the fat out at low pressure. We're going to isolate it into 1 to 1.5 millimeter packets. That's our macro structural fat that we're going to build this out with, and we're going to make tunnels in order to lay the fat in very carefully and then crisscross until we gradually build out. Fat itself is not a very vascular tissue. Think about when you cut into a steak, and it's a rare steak. When you cut through the muscle component of it, there's a lot of nice bright red blood. When you cut through the fat, there's almost no bleeding. There's not a lot of blood vessels in fat, so there's no reason to graft fat into deep fat because there won't be enough vascular supply to support it, or enough lymphatic drainage supply to take away the toxins that all cells make as part of their metabolic function. So you don't put fat into fat. You've got to put it where the vascular plexus is, which is right under the surface. Think about when you get a cut, skin bleeds. Fat, not so much. Muscle bleeds. Bone has a lot of blood structure in it. So, we're going to put the fat just under the surface of the skin where we get the biggest lift in elevation, but it's also the most challenging place to get it symmetrically. Think about if you're making your bed, and as you make your bed and you pull up the sheet, the cat jumps underneath and you see a cat lump. And it's tough to hide. So you have to spread your fat evenly right under that sheet, that skin, so you get an even presentation of the fat and you don't have a series of ripples or lumps or things like that.
So if someone comes in fairly fit and they're wanting to have this done, how much fat do they have to get the projection that they want usually? Yeah,
so that's an issue because of the fat that we are able to remove, and that's based on formulas that we have of how much lidocaine we can give them, how much fat and supernatant fluid we can take out safely. If 50 to 70% of the fat survives, we may need to put in anywhere from 300 to 1,000 cc's of fat per butt cheek in order to get the result that they want long term. Mm-hmm. And not everybody has that volume.
So what do you do for them?
Well, part of what we do is we really, really remove, the fat that is above and sometimes a little bit below the butt to accentuate the butt. So we have to have that chiseled look here in the waist, mm-hmm. That really shows the anterior iliac hip here, and we have to carve in the dimple areas and the area above the around the rhomboids here, and really accentuate that, give that snapped look.
Right.
And then we have to put our fat in very carefully. We have to plan where we're going to budget. Where are we going to get the biggest bang for the buck? Do we need to lift? Do we need to project? Do we need to fill in a hollow that was caused by exercise? And recognize that people who exercise a lot and are really watching their diet, they don't have enough calories on board to feed their muscles and their fat. Mm-hmm. The fat doesn't survive as well. The ideal person for really getting fat that's going to live a long time is a little more of a couch potato than an athlete. And so they've got fat that we can really grab from the waist area and that we can put back here. And if they gain weight, they're going to gain weight proportionally. So the waist will still be small-ish, but the butt could get a lot bigger. Mm-hmm. And we've seen that in some gals where we really snatch the waist. We've put the fat in the tush. It looks really good for that first year or so. Then they quit working out and they start eating more. And all of a sudden we've got a gal with a snatched waist and a back size the size of Montana. And it looks out of proportion. So, that's what we try not to end up with. Mm-hmm. But
a lot of education.
A lot of education and reminding people that if I snatch their waist, they can still get fat under the muscle where I can't get it. So they can still get projection forward and on the sides. They can't depend on the obliques to keep that tight. And of course, the tush, the muscles are deep. Gluteus medius, gluteus maximus, those are deep. We can exercise those muscles, and certainly with people who don't have a lot of fat, we'll use our bioactivators in order to inject that area, and then we'll put them on one of our various energy modalities, electromagnetism or radio frequency, which causes supermaximal contraction of the gluteus muscles, so the muscles get bigger. Mm-hmm. And that's how we get some of our volume and projection.
I feel like that's more of the patient we see. It could be where we're at. We have less Kim Kardashians, people who are couch potatoes that basically do well with the fat because they don't really work out. But I would say a majority of our patients, most of our patients are very athletic, very fit, and come in needing, more projection, but don't really have the fat and aren't going to do well with the fat. So we use the fillers.
Yeah. And, sometimes they're in between. It's worth trying because, maybe you're not a super athlete. You're not working out 3 to 5 times a week, but you're not fully a couch potato. If we can put in fat and we can get you most of the way there with your own fat, that's the least expensive way to go, because you wanted the lipo to snatch the waist and to blend the thighs anyway. So if you've got that extra biodiesel, why not put it in? It's easy enough to do and less expensive to do, and whatever you keep, you get to keep.
So how long would you wait before, if they did want more projection after having as much fat as you could possibly, take from them, how long would they need to wait before they put in a filler on top of that?
We've done it as quickly as 6 months. It takes about 6 months for the inflammation of healing to reduce back to zero. So you don't want to add more inflammation to inflammation that's already there, because the fat that's trying to survive and survive the inflammation of both the surgical procedure to put it in and the fact that 30 to 50% of the fat cells aren't going to survive. So they're going to turn back into oil, which is an inflammatory substance that needs to be absorbed by the body. Those are all things we want gone before we put in more inflammation, which is what a bioactivator or biostimulator actually is.
Okay.
And, and you've got to kind of balance things, because with the bioactivators, we tend to induce gluteal muscle growth, but some of that gluteal muscle growth can break down the new fat you've put in. That's the fat that's most sensitive to exercise. So if a muscle's doing supermaximal contractions, it's calling on the fat around it to supply energy. Some of that fat gets broken down to triglycerides that goes on to feed the muscle. Not the ideal thing, because you're opposing what you're really trying to do. But we've certainly done that. One of the nice things with the bioactivators is we can put them in so dilute that we can blend them underneath the dome of the butt, so it gives a very smooth, supple appearance. It helps with cellulite a little bit. You have to be careful with fat that you don't have areas that glom together and cause little nodules. We've seen that in some patients who've come in where people have not been as meticulous. It takes me probably a good hour or more to migrate and blend the fat into the subdermal plexus. It's not just putting a cannula in and injecting massive amounts of fat with a large cannula. This is really weaving the fat into the subdermal plexus from multiple different directions. It's time consuming in order to get a nice blend, and then standing people up, rolling them on sides to make sure the two sides are fairly symmetric. It takes a long time to do it right. And then afterwards, we're going to gently massage, put them in a little bit of compression, but not as much compression as we're going to use in the adjacent snatched areas. And while we're not going to make them not sit, and sit on special wedged foam pillows and all kinds of things, basically, your body's going to tell you when you need to move. I'll say, if you want to try to sleep on your tummy, go ahead and sleep on your tummy after you've had fat grafting. But the reality is that you're not going to stay on your back so long that you decrease the blood supply to the grafted fat, that it decreases the viability of the fat. So you need to be a little careful, but not a lot careful. If nothing else, you need to drink plenty of fluids to wash out the toxins from any surgery. You need to be on a reasonably high protein diet to help you heal, and use whatever supplements you feel may benefit you from healing. You need to not totally be a couch potato, again, to wash out to assist the lymphatic drainage and wash out the toxins. And you need to eat. You need to feed the fat cells. So, that's something that's important. But I think one of the biggest things that we see in people who come in going, I want a BBL, is they don't understand the snatched part of the procedure that we use to both isolate the fat cells and accentuate the tush is coming from making the lower torso, and sometimes above the torso, above the lower torso, blended and sculpted in order to make the butt stand out. And then some people, if they have enough fat, then we can talk about, in gals, doing a natural breast augmentation. But there's not usually enough fat to really augment the tush and have enough to do upper pole breast augmentation as well. And some people, if they want to have a moderate amount with each, we have enough fat to split both. If they're a larger, a more zoftic person, then we have enough fat to split both. But our donor sites aren't usually quite that plentiful.
So let's go back to the fillers or biostimulators that you can use instead of fat. So if someone doesn't want to go that route, the different fillers that you offer and what's the difference between them and what do you recommend?
Okay. So there's three basic FDA-approved biostimulators that we're using off-label in the United States. One is polylactic acid. So Sculptra is something people have heard about for a long time. And it's basically a bioactivator. It has no filler substance to it. And it comes as a white powder that's lyophilized. It's inside of a glass vial. And we mix it up, and everybody mixes a little bit differently. It just got approved for larger volume mixing, but we've been doing that off-label for years. And this is something that the body resorbs. Takes about 6 or 8 months to see the full amount of growth, and it's sort of an inflammatory growth that this material causes. It was actually an old suture material, an absorbable suture material. And we found with this suture that if we got too close to the surface, the body had an inflammatory reaction and it spit the suture out. People have heard about spitting sutures. And so someone got smart in the pharmaceutical industry and they ground it up very fine. And we resuspend it in sterile saline or sterile water or a combination of things. And then we put it under the tissue in that vascular plexus area where it's going to get a lot of response from the inflammatory components in the body. And you build some inflammation there. And you get to keep that for sometimes 2 or 3 years. In the face, we would traditionally use 1 to 3 vials at a time in the face and in the upper neck and things like that. You have to worry about these little microfilaments or spheres coming together, glomming together and making some nodules and things like that when you use it in the more concentrated volumes that you may use it for in face, neck, décolleté, backs of hands, things like that. And typically wouldn't use these in the upper pole of the breast because they might show up radiographically. We don't want to confuse our radiologists. So we don't tend to put biostimulants in the upper pole of the breast per se. So the polylactate or Sculptra, polylactic acid or Sculptra is one thing that's been around for a long time. We've also had other things like calcium hydroxylapatite, which is a series of microspheres. There's about 18 million microspheres of calcium hydroxylapatite supported in a moiety of methylcellulose, so basically plant, and each syringe has about 18 million, 30 to 50 micron, a millionth of a meter microspheres. And your body will wrap each of those microspheres, given the opportunity, with your own collagen and elastin. So that's why this material has been so successful used on label along the jawline and to give you anterior cheek projection and in the temples and things like that. We don't put it in areas that move a lot. Well, a tush moves a little, but not a lot. Mm-hmm. And you can put a certain amount of this in a very dilute form. So you're not using it as a filler, you're using it as a bioactivator, and you can smooth the tissue. You can get improvement in a subtle concavity like a hip dip or something like that. But for some people that's enough, and some people don't have fat or they don't want to undergo a procedure to get the fat. Mm-hmm. They just want to have a little bit of smoothness, a little bit of projection, a little less hip dip, or one's deeper than the other. We can blend that out with biostimulators. And calcium hydroxylapatite probably lasts a year to a year and a half when it's used like that, but it may be a stepping stone to a longer lasting material, which is polymethylmethacrylate. Polymethylmethacrylate was first approved by the FDA for use in the human face back in 2006. It's been in my cheeks for the past 8 years. We have it in folks from forehead to feet, including boy parts in between. But we started off using it for the tush. And again, we didn't want to cause any concern radiographically, so we don't put it in the breast tissue, but in the tush tissue in order to get some long-term growth, because in the 5-year studies on the face, over 80% of the contour correction was maintained at 5 years. And in the 10-year numbers, it was over 70%. So these biostimulators, which are basically a polymer, same stuff we use to make artificial lenses for eyes sometimes, or to hold in heart valves or hip joints, it's all part of the same polymethyl methacrylate family. We can put into the subdermal plexus area, and we can get some stimulation, and we can take a tush that just needs a little more and make it more vibrant, give it a little projection, give it a little more tightness of the tissue, things like that. And we can engage that with doing gluteus maximus and gluteus minimus super maximal contractions, so those muscles get bigger. So, we push all the microspheres apart from each other in order to get the maximal growth of your own collagen and elastin wrapping. We make the muscles bigger, and we put people on a little bit of a routine, and they can do that periodically to both get and maintain tush. So it's not as projectile as a Brazilian butt, and it certainly doesn't have the snatched waist that's part of the typical Brazilian butt lift, but it's easy, and it's something that is apropos to many people who don't have fat available to be able to get a little bit of projection.
Well, it sounds like there's many has for someone wanting like a Kim Kardashian behind, all the way to someone that just has some laxity and just needs to smooth that out. I mean, and everything in between. So
or a flat butt. We see the PMMA is attractive to a lot of guys who've been told, dude, what happened to your tush? You got nothing to hold it up. And we'll put 10 or 20, 30 syringes over time of PMMA into the tush to give them their tush back.
Right.
And, it makes them look younger and feel better about themselves.
Yeah. So there's lots of options.
Yep.
Not just fat, but also filler.
Correct. So that's a little bit about the Brazilian butt and all the other butts in between. But if for. Thanks for tuning in to this episode of Aesthetic Revolution, the podcast, in our continuing quandary of aesthetic procedures between the forehead and the feet. We hope you will like, listen, learn, appreciate, ask questions, stuff like that, and come back and visit with us again on our next episode. Thanks for joining.